Well, good afternoon, everyone. Well, good afternoon, everyone. As well as the Health and Social Care Minister, we have Dr. Henrietta Ewart, our Director of Public Health, on hand, or in fact on Zoom, to answer any public health related questions. On Monday, we published a roadmap document. I mentioned it earlier this week. Since then, Tynwald has considered the document, debated it in detail, and adopted it unanimously. If you can, I would urge you to take a look at it. It describes where we are going, and most relevantly today, it describes how and when we will be making decisions about how we might amend the measures that we put in place in response to the pandemic. In a moment, I would like to take you through the decisions that were taken at the Council of Ministers today. Before I do, I would like to invite the Health and Social Care Minister to take us through today's statistics. David.
Thank you very much, Chief Minister. The total number of tests undertaken now stands at 3,625, of which we have had back 3,599, leaving 26 results outstanding. The total number of confirmed cases now stands at 329, so we have had 2 new cases since yesterday, and the total number of active cases now stands at 40. Thank you, Chief Minister.
Thank you very much, David. One of the pledges that we made in the roadmap document was to regularly review measures. We said that we would demonstrate the highest levels of transparency towards you. We said that the next review point would be on or around the 8th of May to give us approximately 2 weeks since the last phase of major changes. So this morning I chaired an especially lengthy Council of Ministers meeting. We considered the latest health data available to us, the advice of our clinical leadership, and other important indicators from across our social, economic and law enforcement sectors. We of course wanted particularly to understand what, if any, impact there had been since we made the last changes to our measures on the 24th of April. We of course looked at the trends in confirmed cases, but also the backstory of those cases. I am pleased to say that there was no evidence that any of the cases that we have seen over the last 2 weeks are linked to the sectors that we allowed to return to work on the 24th of April, or indeed any of the changes we made in moving to this stay safe phase. I wish we could tell you more about those backstories, but given the close-knit nature of our island community, this is really difficult without betraying personal medical details, and I'm sure you all understand. Many of the cases we have seen are related to the tragic cluster around Abbotswood. Thanks to some excellent work from the contract tracing team at Public Health, we have good visibility on all the active cases. So, after careful consideration of the data and the clinical advice, the Council of Ministers has therefore agreed to make a number of changes to the measures in place as part of this phase 2 of our plan. I will take you through this in 3 sections, the same 3 sections that we have in our roadmap, that is health, society and economic. So firstly, health. The Council of Ministers discussed and agreed a phased return of a range of non-essential health and care services should now be brought forward. The Department of Health and Social Care has already been engaging with a range of practitioners to discuss how this can be done safely in a carefully managed way that does not adversely impact on our ability to respond to COVID-19. They will be bringing a detailed plan to the Council of Ministers next week, and we will hope to make announcements in the week beginning the 18th of May. I know this will come as a relief to many. I would ask people, however, to be patient. This cannot happen overnight. Bringing services back online is more challenging than taking them offline, especially, of course, when we have to be ready to respond to COVID-19 challenges for some time to come. The Council of Ministers agreed that given the current situation, we can now adjust the advice to those deemed vulnerable and currently shielding, to allow them, if they feel comfortable to do so, to take up 1 hour of exercise outdoor each day where possible. This is an opportunity, not an obligation. But we know how difficult lockdown has been for so many. We believe that as long as people maintain their distance from others and take other hygiene steps, there is real benefit to be gained from some fresh air. I am sure Dr. Ewart will be able to elaborate on this when we take questions in a while. Secondly, society. The Council of Ministers considered a range of options relating to gatherings and the question of household-to-household meetings that I know are important to so many of you to be able to connect with family. The Council of Ministers agreed that we needed to be working towards this. Countries around the world are adopting models that work for their own set of circumstances. We need to do the same. I have always said, Manx solutions for our Manx situation. These options are challenging and we have to find the balance. Balancing what clinically we are advised we may now do with publicly what people need to do and what are ready to do. We have commissioned a detailed paper on this, and I have asked the public health lead to lead on some workshops with groups from across society to test out some of the thinking of this and report back 1 week from now, and I will update you on this important area then. The Council of Ministers agreed that in line with any new measures on gatherings we may consider, we should also continue to work with sporting associations on the island to bring about a phased return to those outdoor sports that can demonstrate, through robust risk assessment agreed with government, how they will operate in a safe manner. This will continue through phase 2 of Stay Safe. We are not yet ready to allow indoor sport to resume, nor are we ready to allow gyms to reopen. The Council of Ministers considered papers on pleasure boats and small aircraft maintenance. As part of our consideration of recreation, we have agreed that people can use their pleasure craft, subject to safety criteria that we have put in place, to ensure that we minimise any risk of impact on our emergency services. Guidelines will be published next week, ahead of a resumption, we hope, before next weekend. On small aircraft, we considered the need for light aircraft to be able to remain airworthy and for pilots to meet what are known as currency requirements. We agreed that from Sunday this could happen with some stringent limitations. I need to make absolutely clear that these two variations in no way change measures related to our borders. Our borders remain closed. We agreed this morning to allow an expansion of the existing hub schools to provide additional capacity for workers in sectors that may return. But I will say more on that in a second. This will of course be done in close collaboration with our teachers and other school staff to ensure that the environment is safe for them and for our children. We agreed that UCM will start to commence a phased return in disciplines where it is safe to do so. We carefully considered our nurseries. We know that nursery provision will be important as our economy reopens, but we are not yet ready to make changes to the measures on this. For the time being, they should continue to only accept key workers from the current list. We will review this again at our meeting on the 14th of May. Thirdly, moving on to the economy, we have conducted detailed consultation with businesses across the retail sector. The Council of Ministers has agreed in principle, and I repeat in principle, that shops and other retail businesses may open from Monday the 18th of May. This will be subject to further assessment of our key indicators and a final decision on Thursday the 14th of May. We have announced this today to give the retail sector the lead time they require to ensure that their businesses are safe places for their customers and for their workers. We will be publishing the draft guidance they must follow and the risk assessments they will need to consider by the end of this week. Meanwhile, I can confirm that garden centres may open to the public from Monday the 11th of May, with social distancing measures in place. We have been discussing this with businesses and with the businesses involved. Again, we will be publishing the guidelines shortly. If they operate cafes on their premises, those cafes will have to comply with the measures in place relating to cafes elsewhere, so takeaway only, no sit-in dining. We did consider whether the time was right for us to allow more businesses, especially office-based businesses, to bring people back into their workplace. The Council of Ministers agreed that we were not yet ready for a major change on this at the time, but that we would start to prepare for this. Employees in our financial, professional and digital services remain obliged to limit the number of staff in the offices to those needed for effective operations. We do anticipate that a phased return may be possible in the near future, and we'll be reviewing whether this could be from Monday the 25th of May over the next 2 weeks. This will be based on rigorous risk assessments that demonstrates the duty of care of the employer to provide a safe place to work, with clear limits on social distancing being in place within the office environment. It is unlikely anything approaching the previous levels of occupancy will be seen for some considerable time to come, if it ever will. We are therefore sympathetic to those companies who may wish staff to visit their place of work to determine how a partial and phased return will be done and put in place necessary measures. We will adjust regulations accordingly. Moving on to other matters, I have already announced that the Council of Ministers had agreed in principle that those returning residents who meet certain criteria, could quarantine at home rather than in the Comus Hotel. Today we considered this in more detail. We have approved the criteria, the process and safeguards, and hope to be able to publish full details on Monday. We have talked about balance many times before. We need to balance the need to return to normality across health, society and the economy, and have announced some changes in each of these areas today. These are gradual changes being made in a measured manner, and we will issue further details on these aspects shortly. And of course, all of our measures will be subject to constant and regular review. I will now take questions. And first today I have Mr. Paul Moulton from MTTV. Paul.
Thank you, Chief Minister. I mean, we're 2 weeks in now from having it opened up for construction, and clearly this is fairly well contained now. There's probably going to be quite a lot of frustration that things aren't moving a bit quicker. Do you accept that? I mean, we had a terrible link to you, by the way, so my apologies, but you're not opening hairdressers and things like that, even at this stage at all? That's not on your list?
No, that's not on our list, Paul. I think that's further along. I've said time and time again, we will be taking small steps, regular steps. We'll be looking at the evidence, reviewing, and then if the evidence enables us to make changes, we make those changes. So we made some pretty major changes 2 weeks ago, where effectively 4,500 people from the construction industry went back to work. Now, I was castigated by some of you for allowing that to happen. But we had the data. We believed that we could allow that to happen without there being a spike in that data. We were proved right. Obviously, we can't be complacent. We have to keep on looking at data. And now we are making the next changes, which will allow all our retail shops to come back, all our garden centres, people to go out in their boat, people to maintain their planes. These are major changes that we are taking. So I don't think they're minor, but we cannot expect to suddenly open everything up straight away. We've got to look at how they can be operated. Are you able to do social distancing when you're cutting someone's hair, for example, Paul? The answer is no. So I'm afraid that was never going to be in the early businesses that were allowed back to work. Now, of course, I understand. I've got many a friend who are hairdressers, and I know how keen they are to get back to work, and I know an awful lot of people. I've had emails from people who are keen to have their hair cut. They see it as part of their social balance of life. But at this moment in time, it cannot be considered. Obviously, getting my hair cut is a very important thing to me.
And could I speak to David Ashford, please, just to do my usual crunching of numbers, please?
Okay.
Thank you. I guess you know what I'm going to ask
I
you,
may
David.
be able to predict the question, Paul, but go on anyway.
I wish you would just give us information. It would help me not be accused of asking
So
the
is
same
it in
question
relation
day
by
out.
any chance to yesterday's case and the two today?
Yeah, because I'm getting, on a serious note, I've got a report here that it may have jumped, but I'm hoping you can clarify where these two cases are from. Can you?
So the two cases, I can confirm yesterday's as well. I've been given the information. Yeah. One case, so we'll take the three, which is the one yesterday and the two today. One case had felt unwell for a couple of weeks and had stayed at home during that time and was referred for testing after making contact. And then the other two cases, they are healthcare workers, but in both cases at the moment, there's no established link between their work and any contraction of COVID-19.
Right, and what I'm basically getting at, I got a very strong report, but obviously it's just that it's moved to another care home, or this person potentially has a connection to a different care home. Can you confirm or deny, please?
Not in relation to the information I've got in front of me.
Thank you. Thank you very much.
But obviously, if anything changes on that, Paul, then I will confirm to you at a future press conference.
Did that count as a question? Can I ask you something else?
You can ask me something else if you want, Paul.
Okay. Just about the dentist thing. It's been. I had quite a lot of feedback from dentists yesterday, and a new normal could be maybe 4 people a day because of deep cleaning and everything that goes with it. And they're extremely worried. Obviously, dentists can't make money on 4. We're talking about drilling here. You know, that's when you've got all the dangers with the aerosol stuff. You must be having a think of that and give some hope to dentists, please.
Well, there is a review going on what processes dentistry-wise we can turn on. I think, as I've said at previous press conference, it has to be done with dentistry stage by stage. It's not going to go from where we are now to suddenly having full dentistry services back in place. A lot of what dentists do are aerosol generating procedures, and that is a very high risk process, particularly in the current environment we're in. So we have to make sure that anything we turn back on in relation to dentistry is done in a clinically safe way, and that is the overriding concern. That's to protect the patients who are coming into the dentist, but also to protect the dentists and their staff as well. So I know it will be frustrating, and I know there are concerns out there, but I have to emphasise again that anything we do in turning health services back on, and that includes dentistry, will only be done in a staged clinical approach.
And would you prioritise that 60-minute test if and when it becomes available as a solution to the problem? That if people know they haven't got it, they could be seen by doctors as well as dentists and other people who might be putting themselves in risk.
Well, we spoke about the testing strategy on Monday when Dr. Khan was here. In relation to the testing, let's wait until we get tests actually available. As Dr. Khan explained, though, with the 60-minute test, we will be limited in the amount of tests we'll be able to perform in that and the amount of cartridges that we will actually be provided with and have access to. So we need to make sure that any of that, it really is very much targeted testing where it will have the greatest effect for us, because it will be in limited supply.
Thank you very much, David.
Thank you very much, Paul. We now move on to Josh from ITV. Josh.
Thank you, Chief Minister. My questions are for the Health Minister and Dr. Ewart, please.
Okay, well, do you want to go first with Dr. Ewart?
Yeah, for both of them, really. Just to get some more info on the social changes that may be coming soon. Has the social bubble scheme been suggested as an option, as seen currently happening in the Channel Islands, where one family buddies up with another one? And if not, can you explain why that one in particular did not seem like a Manx solution?
We're exploring it. As Chief Minister said, we're going to be doing some focus groups across the coming week to actually look at attitudes to that. The Guernsey scheme has drawn heavily on what's happened in New Zealand, obviously, and some of the issues there are, whoever you choose as your reciprocal household, because it does, household A has to designate household B and vice versa. There are all sorts of issues around that about, if you think about grandparents, for example, you have to select one set of grandparents and exclude the other, potentially. So there are issues around it and around the acceptability of it and how people feel about that. And we hope to get a bit of qualitative information around perceptions of that in the groups next week, which will feed into that. But yes, definitely being considered.
Yeah, just to follow on from what Henrietta said there, Josh, I fully echo everything that Henrietta said. And as it's important with any policy we do, we've got to make sure that policy is right. There's no point rushing something in without it being thought through. So we need to consider how any bubble would work. As Henrietta has said, what household A dominating household B, particularly around grandparents, that's one set of grandparents that's being excluded from that. So we really need to have a think of the impact of the policies that we actually deliver, not just in terms of the medical impact, but also the societal impact as well. So it needs to be very, very carefully thought through. And as I've made clear from day one, we are not going to rush policies out until we have had that thought process and how it can be implemented and run effectively.
Okay, thank you. And my second question, Public Health Isle of Man is obviously closely linked to Public Health England, but now that the Isle of Man is effectively a few steps ahead of the UK, how much advice are you taking from Public Health England now? And are they now in fact taking more advice from yourselves than they were?
I don't think our relationship really works exactly like that. We don't reciprocally give or take advice directly. We share what we're doing through various fora. We learn from them, obviously things that they can do at scale that we can't do. We would take the evidence from there, but it's not a relationship that involves anyone, giving advice or taking advice in that kind of a way.
Yeah, it's a reciprocal forum for sharing ideas and sharing processes. It's also good to see what the experience has been of different jurisdictions, particularly our close neighbours, when they've tried to take certain steps. And I'm sure they'll be looking to us to see what's happened here when we've taken certain steps. In relation to that, I've said from day one that, while we might look to other jurisdictions and see what they are doing, our advice has always been guided by Public Health Isle of Man. That is where the advice comes from, that the decisions then taken by Council and Ministers is based upon, and that's not changed throughout the entire process. And, it comes back to that phrase the Chief Minister has used many times, having a Manx solution to Manx problems. So while we might see what's happening in other jurisdictions, we apply that where we believe it's most effective for us.
Okay, thank you.
And thank you very much, Josh. Moving on, we've got Energy FM and Chris Cave. Chris.
Good afternoon, Chief Minister. The more businesses that open, the more people that go back to work. That naturally leaves more and more young people who need looking after. When, therefore, are schools and nurseries expected to reopen in your forecasts if everything else goes according to plan?
Well, obviously, this is something the Minister for Education, Sport and Culture is working on with our teacher representatives and other workforce representatives. And I think I mentioned that the UCM are looking to expand their programme and start up again. So I would hope to have more announcements on that in a week's time. But it has to be done properly. We have to make sure that our young people are safe and our teachers are safe. It's harder to do, obviously, because young people don't understand. If you're a toddler or 4 or 5, you don't really understand what social distancing means in your mind. So it's a tougher one to come up with. But obviously, it's something that's been worked on all the time. So the minute I can give you details, Chris, and everyone, I will on that.
And could I just ask the general consensus of the teaching bodies about how they feel safe in their environment about going back to work?
Well, let's remember that we already have 8 hub schools open on our primary schools, and all our secondary schools are open, and teachers are working a rota there. So we never closed all our schools. We just closed a number and kept going with the 8, because those 8 primary schools had the classrooms that looked after our children that had special needs, and we felt it was really important that we were able to keep that service going. So we are working with them. Obviously, we have to come up with a solution that's safe for everyone, but I'm confident that we will be able to start to increase the numbers in the next week or so. But obviously, the Minister for Education, Sport and Culture, Dr. Allinson, will be giving updates on that in the near future. Thank you very much.
Thank you. And in an era of baby steps, the easing of restrictions just to allow people into the garden to see loved ones is seen as a massive leap back towards normality. I suppose this is building on Josh's question from ITV, but following on from today's announcements, can you tell us whether or not we're likely to see more information, such as we see in Jersey and Guernsey's exit strategies, on how socialising with our family and friends will change through each phase?
Well, really, I think Dr. Ewart has already said, we are looking at how Jersey and Guernsey have implemented their plans. Jersey have done the partner family system for their own little bubble. We are ahead in stages. Jersey and Guernsey, for example, shut down all their schools. We didn't. We're at different levels in different areas, but we will observe what happens there. But it's got to be little steps safely, and I think the visit of 2 family members to see a loved one is one step forward. I have asked our medics to go away and public health to look at a way where we can have larger gatherings from one family unit with maybe another family unit, but we need to make sure that whatever we do is safe. And I think we in the Council of Ministers have announced another major raft of changes today. I don't like doing major changes all the time, because we need to see the impacts of what we've allowed to happen before we make the next stage. So it will be continuously little steps all the time, review and then move forward if the evidence suggests we can. If a problem comes along and we have to reverse a little bit, then so be it. But so far it's gone well. The Great Manx public haven't let us down. They've followed the rules sensibly, and as a result we're only seeing minimal number of cases. But as I say, we can't be complacent. Social distancing, hand washing, and if I can still restate, staying at home is still the best thing to do. If you can stay at home for a while, then please do stay at home, appreciating people have to go out, but where possible, stay at home for as long as possible is still our advice. That is the safest way for everyone.
I suppose essentially what the question was, though, like we saw in that 27-page document which was published on Monday, it showed each phase when certain sectors were expected or when it was safe enough for them to go back to work. Will we see that build up, if you like, with the socialising with our friends and family? Will that be published in a document, or will you just be announcing it in these press conferences as and when that it's safe to do different things?
Well, we will be working up the evidence on how we can do it, and that's going on as we speak, Chris. Once we have that evidence, then we will be advising people maybe that from a date, this is what they can do, and we will be putting that evidence on our website so that people can see. But we will give people a lead in time. But at this moment in time, Chris, the data is being worked on by public health. I don't know if Dr. Ewart wants to add anything to that.
No, I think you've covered it really. I mean, the whole essence of this is start low and go slow. There is a whole raft of things that have been applied, and they can all be lightened. But if we do too many at once and the curve starts shooting up again, we're not going to know which were the real drivers of that and which ones to focus on in reining back. So we really do need to take this a step at a time.
Okay, thank you, Chris. Alex Bell from BBC. Alex.
Thank you, Chief Minister. And I'd like to throw this question to anybody who wants to answer it, actually. Sorry to beat the same drum, but it must be incredibly disappointing, possibly borderline offensive, to people who haven't seen parents, children, partners to hear that while they have got to wait another week for any update on whether they can see each other, people with private jets and yachts can go out and take them for a spin. What assurances can you offer to these people?
I'm trying to understand where you're coming from, Alex. We're allowing people who have their own boat, a pleasure boat, to go out to sea, and there will be certain rules and regulations. Planes is purely from a safety point of view. If the planes have to be maintained, you can't just start the engine up of a plane, sit it there for half an hour and then switch it off and that's it done. They have to be flown, and people have to keep their licenses. Now, we are allowing people to go and visit a loved one, but they can see them from the 2 metre distance from their house, either out on the street or in the garden, if that works. Now, that means everyone can see a loved one if they so desire. They just have to do it in a sensible way forward. So I think your phraseology was unfortunate.
Yeah, well, what I meant is to suggest changes to things like pleasure craft and planes does seem a little frivolous compared to the very real problems that families are facing with not being able to see each other.
Well, that's why we allowed people to go and speak to one another. Obviously, we've allowed golf, we've allowed fishing. You didn't realise that. We've got to allow people, where possible, to go about their normal way of life as soon as possible, but safely. And at the moment in time, we are trying to work up a policy where it is safe. There are 3 reasons we have such a flattened low curve. 1 is we close the border. 2 is we test, trace. 3, that the Great Manx public followed the rules on social distancing. We are in the position we are now where we can start to review and allow events and activities and who we see back as a result of those 3 events. But as Dr. Ewart said, if we allow too much activity at once and we see a spike in the number of cases that we get from coronavirus, then we won't know what caused the spike, and even with the tracing. So we are looking at how we can maybe increase the number of visits or the number of people who can visit one another, but of course you would still have to do the social distancing. That's being worked on, and I think some of the steps we've made, I've had really good feedback from people who are really grateful that now a family member or 2 family members can come and see them, albeit from the 2 metre distancing.
Thank you. And just as a follow-up question, if you like, to Dr. Ewart, if I could, please.
Yeah, Dr. Ewart.
There was mention today of focus groups happening over the next week. Very useful to measure public opinion, I'm sure. But as the administration has insisted over and over that clinical advice is the main guider of policy, why are decisions being put in the hands of the public?
They're not being put in the hand of the public any more than they're being put in the hand of the clinicians. These are all different perspectives. Clinicians have a specific perspective, and the most important one around that is their assessment of what changes could do to demand on healthcare, whether it's going to destabilise the health service. So that is very much their area of expertise. But there are a lot of other areas in which the fact that you have a medical or other clinical degree or professional background doesn't actually qualify you to speak with any expertise at all. And those sources of information need to be taken from other sources. And the perspective of people who actually live the experience of the restrictions, the sort of people that we're hoping to involve in focus groups, is very, very important. And within that, there are very specific groups like the over 70s. How do they feel about restrictions? Do they feel that they need extra protection, or do they feel that that's patronising? All of those things a professional group can't really speak about because the professional group doesn't live that experience. So that's why we need to try and get as many different perspectives as possible in order for the government, our politicians, to actually make the most informed decisions.
Thank you, that's very helpful.
Thank you very much, Henrietta and Alex. So now it's Sam Turton from Isle of Man Newspapers. Hi, Sam.
Good afternoon, Chief Minister. Building on the questions there from Alex, with the small aircraft being flown, how is this going to work in terms of who's policing it and what restrictions will be placed on people who take their planes out?
Yeah, thanks, Sam. Yeah, these will be published on our website, of the restrictions that people have to comply with. And obviously they won't be able to go outside of the Isle of Man's territorial waters, and it will be for a certain time that they will be able to fly. Planes cannot just sit there unused, and as I said before, they can't. Just warming the engine up on the runway isn't good for the aircraft. So the aircraft needs to be properly maintained to be safe. But also, if you're a pilot, or I'm not, I hasten to add, but if you're a pilot, you need to do so much flying every month, etc., to keep your license going. And that's what we don't want, is at the end of this period to find out that everyone who has a plane can't fly it until they've reset their pilots exam. So these are just practical measures. It's not allowing you to go up with your family and have a joyride around the island. It's practical measures to deal with a practical, with a problem that's been brought to our attention. And as I say, these guidelines will be fully published, and they will be allowed to do it from Sunday.
Yeah, and secondly, you said about expanding the education hubs. So we've spoken to the teaching union this afternoon, who said, as far as they're aware, schools will not be opening soon beyond the current hub supporting key workers' children. What exactly are the unions aware of before they come to these press conferences? Because it seems to be that we're getting told two different things about the exact same events here.
No, I've always said clearly, Sam, that nothing will happen without the agreement of the teaching unions, the teaching representatives working with the department. So what I would expect to see is that some of the hubs start to increase certain areas of numbers of children, and then working together, certain schools will open. But this will be in a slow, step-by-step manner. We will not see every school being announced in 2 weeks' time as opening. It will be small steps, and I've said time and time again, it will be between the Department of Education, Sport and the representatives of the teachers to come up with a solution. But obviously it has to happen, but it will be in small staged manners where the safety of the teachers and the safety of the young people will be the considering factor.
So when the shops reopen, does that mean that people who will be having we could be able to go back into work, does that mean that their children will be included in the list of people who can go to the hubs?
No, I said clearly in the speech that the list on the hubs for those taking the ability to take children to either nurseries or schools will stay with the current list. It's only once we've worked out a solution on how we can expand the schools that we will allow more children to go back to the relevant schools. Thank you very much, Sam. Now we have Amanda Cashmore from Jeff the Mongoose. Amanda.
Hi, thank you very much, Chief Minister. Firstly, we've been hearing a rumour that there's going to be a cancellation to the Senior Race Day bank holiday. Is that true?
Yes, I believe a press release will be going out. We're not going to have a Senior Race Day. A decision has been made, and that will be going out to the public very soon.
Can I ask why that's been made when the public possibly needs more morale than ever before?
Well, I think there's been an awful lot of days where people haven't been able to get out and about, so giving them... Normally, it's normally Senior Race Day with most businesses, or Tynwald Day. And as we're not having TT Fortnight, it seemed illogical to have Senior Race Day off when we don't have a Senior Race Day, Amanda. Obviously, it will be back next year.
Thank you very much. And secondly, our question for Dr. Ewart, if I may. The microbiology team working at the testing centre have come off other jobs to increase the island's capacity for testing. Are you certain that staffing levels can be sustained as the island ramps up to capacity to test both key workers and asymptomatic people, as the document released earlier this week states? And could that last for a prolonged period of time? Would you be able to sustain that staffing level?
Can you just clarify me which staff group you're referring to? Are you talking about the people who take the swabs, or the people who process them in the lab?
The processing of the testing centre.
Right, I mean, that is largely automated, so the limiting factor are more about the equipment and the reagents and the platform that the testing is done on.
And is that sustainable for a prolonged period of time to increase that testing and to sort of carry that on over the next couple of months or even longer?
Yes, it should be. It should be.
Thank you.
Okay, thanks very much, Amanda. We now move on to Alex Wotton from Manx Radio. Alex.
Good afternoon. Could my first question be for the Health Minister, please?
Yeah, no problem. David.
Thank you.
Good afternoon, Alex.
Good afternoon. Can we have an update on how many people in Abbotswood Nursing Home are currently positive with COVID-19 and what percentage of the home, of the residents that is? And do we know if there's a presumed recovered number for the home specifically?
I can give you all apart from what the percentage of residents is because I don't have it here. But in terms of currently active around Abbotswood, there's 19 current active cases, which breaks down as 1 in the home, the 12 in Newlands that we've previously reported, 6 in hospital, and the recovered figure is 7.
Okay.
And I should emphasise that's presumed recovered in the same way as we calculate everything else.
Okay, and my second question is for you as well, actually. Could we have an update, if possible, on the Sir Jonathan Michael report? Has the current pandemic changed the pace at which any progress is being made?
It has changed the pace because obviously we've had to redeploy staff elsewhere across the department. We have made progress on some of the things mentioned in the Sir Jonathan Michael review, though, such as telemedicine and around telephone consultations, because we've had to do that as part of this pandemic planning. And as I think I've stated at the podium before, there's some things that we've already changed around services that we will probably want to keep past this. And certainly telemedicine is one of those. So yes, there has. We will be extending the consultation in relation to Manx Care and the bill that will be coming before the House at some point, and we will probably have to push back the date for the implementation of Manx Care because there has been impacts in that regard, and also the advertising for the Chief Executive of Manx Care has been put back as well because we don't feel it's appropriate to be going out for that at this time.
Do you have a number on the delay then?
We keep talking about timescales, and again, I know it frustrates people, and I know it frustrates our partners in the media, such as yourself, more than ever, but I'm not willing to put timescales on things because it depends when we can turn services on and get DHSC back into the normal position or as near to normal as possible. At the moment, the whole focus around the Department of Health and Social Care is our fight, quite rightly, our fight against COVID-19.
Thank you.
Thank you very much. Alex, we now move on to Leanne Cook from 3FM. Leanne.
Good afternoon, Chief Minister. You've confirmed today there will be a phased return of non-essential healthcare on Ireland. Could you just clarify or give more detail as to what this will actually cover?
Well, obviously it'll cover minor operations, podiatry, chiropractor, dentistry. I don't know if Dr. Ewart wants to add onto the list. It's being worked on, so it's got to be done. Again, I keep on mentioning this in a safe way forward, and proper procedures have to be worked on how you can protect the patient and your own safety when doing it. I don't know, Dr. Ewart, if there's anything you can add to that.
Not really, because this is obviously an operational DHSC issue, but I do know that operational colleagues are working on the prioritisation and timing and phasing of this at the moment.
Yeah, I'll bring in the Health Minister, and he might be able to shed a little bit more light on the exact types. But that's what I've said I would expect to be the case.
So again, Leanne, it's about a phased approach. As I think I've said before, it's a lot easier to turn things off than it is to turn things back on. We've got services around, for instance, cancer patients at the moment that are suspended. So I think, as I've announced previously, we'd be looking again in a staged approach at the various different types of cancer treatment and cancer care we provide and turning those back on. We've mentioned another one here today, actually earlier on, which is dentistry, and how we can do that in a proper clinically managed phased approach. And then, as the Chief Minister has said, those around the minor operations, which is known as elective surgery. We suspended all elective surgery at the start of this, and as we start changing our processes, we will look which areas of elective surgery we can bring back online. So those are the main key areas, but I do need to emphasise again, none of those services are going to go from as it is now to back to normal in one step. It will be a very much a phased approach based on clinical safety, both for those who are actually undertaking the procedures and also the patients themselves.
I think before we move on, Leanne, what this is showing, that it doesn't matter whether it's golfing, whether it's fishing, planes, boats, health issues, practices that have had to stop. We have to work with the industry or the representatives of those areas to come up with a safe strategy on how we can take it forward. And that's what we're doing on a number of issues. It's what we have done, where we've successfully reintroduced some areas, but we're constantly working behind the scenes on how we can come up with strategies to make it work, but also make it safe. That's the most important thing. We've done so well as an island to flatten the curve, but we can't throw it all away by being irresponsible and maybe rushing in returns in some areas until we've come up with a proper strategy on how we can clinically deal with it, but have a good health and safety and public health offering in these areas, Liam. Okay, right, and finally we have Simon Richardson from Business 365 magazine. Good afternoon, Simon.
Good afternoon. I'd like to return to the matter of opening the Isle of Man's borders. If we reach a point at which the Isle of Man is statistically clear of coronavirus, but it's still prevalent but declining rapidly in the UK, would this be a point at which the borders might reopen?
I think it really would have to be on the advice of our medics on this one, Simon. And it may well be that it could be another jurisdiction on the other side of the island that gets to come back to the island first. It really will look, if we're in a good place but our neighbours aren't, then obviously there's no point opening the border for them to import the illness back into the Isle of Man. That would be an absolute disaster. So I think it's going to be quite some time away, Simon, before we open the borders, and nearer the time when we can look at the levels of infection in either the United Kingdom or the island of Ireland, that's when, nearer that time, we can make a sensible decision, and it will probably be, again, little steps, not a sudden opening up of all the borders. It'll be a controlled, phased approach.
I suppose what I'm saying is, though, the UK, it's very unlikely that it would be completely clear of the disease for a very long time. Would there be a point at which, though, it might be considered safe under certain circumstances?
Well, I suppose it depends what those circumstances are, and that will have to be considered. But we are way in the future, and who knows the antigen testing, if it's up to the 99% reliability, which I'm led to believe it isn't at the moment, then that might be a factor that could be considered. But that's not for me as a politician to advise you. It really is our clinics and our public health to advise us as politicians when that level is likely to be there. But I think for a considerable time, we will not be seeing any open borders with either the UK or the island of Ireland or anywhere else until we feel it would be safe to do. That's down, if you look at our stages and our phases, that is the very last thing to take, for it to happen. Obviously, we still have the repatriation and the key workers and the hospital patient transfer system, putting them aside.
And finally, the UK is now, it seems, facing its deepest recession for over 300 years, with a huge rise in unemployment and the loss of thousands of businesses. How much do you believe that the economic crisis that will follow the pandemic in the UK might hinder the Isle of Man's road to recovery?
Well, we can never say for certain, Simon, but I think it's important to point out that 80% of our trade is with the United Kingdom. And before this pandemic happened, I had been saying that we needed to revisit the percentage of trade we have with the UK and look at the rest of the world to see what countries were areas where we could expand our business, and that's what the Department of Enterprise had done. They'd come up with a country by country strategy to see where the Isle of Man might be able to increase its percentage business. The UK will always be our biggest trading partner, but we are reliant on it to 80% of our trade, and therefore if they have a significant reduction in business, we can expect to have an impact from that. But obviously we're a resourceful island, and I'm sure our business leaders will help us bounce back as quickly as possible. Thank you very much.
Thank you.
I'll swiftly move on because we've been at this a while now, so I won't be doing any shout outs today. You've heard enough from me. But I would just like to remind you all that tomorrow is the 75th anniversary of VE Day, Victory in Europe Day, and that's tomorrow. An awful lot of people made the ultimate sacrifice for the freedoms that we take for granted today. And please, can you join me in observing the 2-minute silence at 11 a.m. tomorrow? Until the next time, please stay safe, make the right decisions for you, for your families, and for our island. Thank you very much.